Community obesity prevention in high school children, the physical and emotional health of an entire generation, and the economic health and security of our nation is at stake. First Lady Michelle Obama at the Let's Move launch on February 9th, 2010. This is a community health promotion presentation for Nursing 370 by Catherine Laughlin. The problem: a community in Birmingham, Alabama has a high prevalence of obesity and has asked a group of nurses to teach health promotion and education to the local high school, George Washington Carver High School. There are two problems. The first problem is the school lunch. The lunch program serves typically southern fried fatty foods with a high sugar content. Problem number two, physical education. There is no organized physical education program through the school. Assessing the learning needs of the community. Human biology. The community of the local high school is 93% African American, 6% Hispanic, 1% white. 67% of the students are overweight or obese with a BMI of greater than 25%. This is important because the ethnic groups of African Americans and Hispanics tend to have higher rates of obesity, diabetes, and metabolic syndrome compared to other ethnic groups. The environment. 87% of the students qualify for free or reduced price lunches. The school does not have an organized physical education program. This is important because 87% of the students this means that 87% of the students are at the poverty line or below, and that the school doesn't offer any opportunity for them to exercise. Community lifestyles. The school cafeteria serves typical Southern cuisine, foods that are fried and high in sugar. Southern food tends to be like fried chicken and also sweet tea. A lot of added sugar, a lot of added fat, so it's not very healthy at all. The health system. 73% of the students have not seen a doctor in the past year, and there are only 3 school nurses for the 7 high school schools in the district. So what this means is that 73% of the students don't have a primary care physician and are looking to the schools for their health care. And because there are only 3 school nurses for the 7 high schools, the school nurses, their healthcare provider is being spread very thin. They're being spread very thin. The health promotion model that I'm using is the Precede-Proceed framework. The Precede-Proceed framework is a framework, and that PRECEDE is an acronym for predisposing, reinforcing, enabling constructs in educational ecological diagnosis and evaluation. Phase 1, social diagnosis, predisposing, ineffective community self-health management related to obesity epidemic as evidenced by 67% of students with a BMI of greater than 25%. Phase 2, epidemiological diagnosis, reinforcing. The problem extends outside the school with obesity at epidemic levels in the community. Phase 3, behavioral diagnosis, enabling. School lunch is typically Southern fried fatty foods with lots of added sugar. While there are some fruits and vegetables offered, the students typically bypass them at lunchtime. Phase 4, educational diagnosis, educational ecological. The school itself does not offer any health or cooking classes that discuss proper nutrition and diet. Phase 5, administrative and policy diagnosis, evaluation. Also, while the school has a sports team, it does not offer regular physical education classes. The second part of the Precede-Proceed framework, PROCEED, is an acronym for Policy, Regulation, Education, Environment, Development. Phase 6, implementation or policy. As an obesity prevention program can only be as effective as its members, we will implement programs that include the community in healthy eating and exercise. Phase 7, process evaluation, regulatory. We will evaluate the process of the obesity prevention program by participation in various activities. Phase 8, impact evaluation, educational, environmental. By including the wider community in these changes, we hope that the impact of the obesity program will extend to the students' families and wider community. Phase 9, outcome evaluation, development. We will evaluate the success of the obesity prevention program by monitoring the BMI of the students. Success will be indicated by a drop in overall student BMI average. Health promotion, health education plan. The goal of this health promotion, health education plan is by the end of the next school year, the student's average BMI will drop by 3 points. Research and other evidence. There are 3 papers that I looked at. The first one, according to Jarowski, Mills, Lawson, Bovenzi, Quarterman, and Davison, for new health promotion and teaching to be successful with students, parents need to be involved in more than just a supporting role. What this means is that the parents need to be actively involved with any changes that happen at the school for the health promotion teaching to be effective. And instead of it being primarily the school that's pushing this, we need also the parents to be as involved or more involved than the school itself. The second article, in their research article, Patino, Hernandez, Villa, and Delamater state that for an obesity prevention program, research has found that among middle and high school students, school nutrition policy and parental control over the child's nutrition and physical activity, all 3 of those together, are associated with the child's weight status. So what that means is that it can't be just one or the other. It has to be all 3. And then the last paper, authors Subica, Grills, Douglas, and Villanueva suggest that an even broader focus is necessary. So especially in these communities where it's minority, they're minorities, they're below the poverty line. We need to not only have just school and family focuses, but also community focus. So it needs to be a wide, broad changes that the program reaches. We need to talk about policy change. We need to get the community members involved, community leaders, the school, and the parents. The problem. A community in Birmingham, Alabama has a high prevalence of obesity and has asked a group of nurses to teach health promotion and education to the local high school, George Washington Carver High School. There are 2 problems. The first problem is the school lunch. The lunch program serves typically southern fried fatty foods with a high sugar content. Problem number 2, physical education. There is no organized physical education program through the school. Conclusion. The literature indicates that for a school obesity prevention program to be effective, families and the community must also be involved. Some suggestions of how to involve everyone. Number 1, hold monthly student, parent, teacher evening assemblies with themes, cooking demonstrations, Zumba classes, breakdancing exhibitions. Number 2, have elected officials, community leaders, and teachers perform karaoke at the school dances to encourage student attendance with the secondary advantage of adult supervision. I think that most kids would love to see community leaders make a fool of themselves in front of a whole school. And number 3, during summer months, hold Friday night schoolyard healthy creations, picnic, and potluck with recipe exchange. In this way, we keep the school involved during the summer months, and it can be we can include the families, the schools. We can even include community leaders at these events. I think that's everything, and this concludes my presentation for my community health promotion plan.